Welcome back to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Today we're going to talk about biofeedback. Now, biofeedback is a metric. It's a measurement tool. It's a way to look into your autonomic nervous system in real time. The treatment is still things like breathing, muscle relaxation, visualization, meditation, mindfulness. And the biofeedback just lets us see how your nervous system is responding to those tools moment by moment. And that matters because when your nervous system can see what it's doing, it learns faster. Today, I want to break down what biofeedback actually is, the different ways we can measure the nervous system, and why this can be such a powerful tool for people dealing with persistent pain, dizziness, headaches, concussion symptoms, and really any condition where the nervous system is stuck in protection mode. And after we discuss biofeedback, I'll teach you a new self-regulation technique that you can do whether you're measuring it with biofeedback or not. So let's get started. Biofeedback simply is a way to measure your nervous system using technology. Bio is your biology, and feedback is the feedback you get from a piece of technology, whether it's observing your heart rate variability, observing your hand temperature, the sweat on your hands, the amount of muscle tension you have. And you could look at all these different metrics to see if your nervous system is in a relaxed state or it's in a stressed state. Biofeedback's not a treatment, it's a metric. The treatment is the breathing, muscle relaxation, visualization, and biofeedback just measures your autonomic nervous system's response to that treatment. Simply put, biofeedback is a way to measure your physiology in real time so the nervous system can learn. And when you're aware of what your nervous system can do and how you could have some control over it, it's going to help. It's going to help your symptoms and it's going to help you feel better. Biofeedback is a real-time measurement of the autonomic nervous system. And it's great that we have this technology because you usually can't see. Sometimes when people do breathing exercises or meditation, they might feel relaxed, but how do you know? How do you know it's lowering your heart rate, or how do you know it's improving your heart rate variability? It's great that we have these tools, and we're going to talk about a lot of different tools today. Wearables and real-time biofeedback technology. We could really understand what this is and how we could use it, how everyone could use it to improve their symptoms and just to improve their health. It turns physiology into visible information. We could understand how the nervous system is responding. Before we could talk about biofeedback, we have to talk about the nervous system again. Let's talk about the autonomic nervous system. What is the autonomic nervous system? Your nervous system is made up of your brain and your spinal cord and all the nerves that exit out of your brain and exit out of your spinal cord. There's something in the brainstem that we call the autonomic nervous system, and this autonomic nervous system controls your automatic functions. It controls your heart rate, it controls your lungs, it controls your digestive system, your urinary system, your reproductive system, your immune system. So it's basically the autopilot of your body, right? This autonomic nervous system controls all your automatic functions, and you don't need to be consciously aware of your breathing or your digestion. It just works on its own. This is the autopilot of your body. It's the autonomic nervous system. Now, there's two branches of the autonomic nervous system. There's the sympathetic branch and the parasympathetic branch. The sympathetic branch we call fight or flight, and the parasympathetic branch we call rest and digest, or rest and repair. What this actually means is, let's say that you were swimming. I was working with a surfer the other day. I gave this example. What if you were swimming in the ocean, or you're on your surfboard in the ocean, and all of a sudden you see a shark swim by, you see a big dorsal fin? What happens? What happens is you're going to get a rush of adrenaline and cortisol. Your pupils are going to dilate. You're going to get super focused, and all your body's resources are going to go towards the large muscle groups and your focus. The body's resources get diverted away from your digestive system, your urinary system, reproductive system, immune system. It gets diverted away from there because those aren't important for survival in the moment. then all your body's resources are going towards your large muscle groups and your focus. And if you're really focused and really strong and really fast, you have a better likelihood of survival. That's why we call it survival mode, and that's your sympathetic nervous system. And it's important, and it's not bad. Your sympathetic nervous system is really important for when you're getting ready to play sports, or you're getting ready to focus or give an interview or anything, like have to go to an important meeting. The Super Bowl is coming up, preparing for the Super Bowl. So you want to be in your sympathetic nervous system. You want to be focused, you want to be strong, and you want to be fast. Now, when that shark swims away and you no longer have that threat, your body should shift over towards the parasympathetic branch of the autonomic nervous system, which is rest and digest. Now, all the blood flow and all the body's resources get diverted back to your digestive system, urinary system, immune system, reproductive system, your heart and lungs, and then your body works and it could heal and it could digest, because you no longer have a threat and no longer have that need for survival. Oh, that's how the autonomic nervous system works. Oh, and if we think about it, what happens to our physiology when you're in fight or flight? When you're in fight or flight in that sympathetic branch of the nervous system, your heart rate is going to increase. Your breathing rate is going to get faster. Your muscles are going to get tense and your hands are going to get cold and sweaty. And the great thing about using biofeedback is we could measure all that stuff. And then when the shark swims away and you're in that parasympathetic branch of the nervous system, the heart rate is going to decrease. Your respiratory rate is going to get slower. Your muscles are going to be less tense and more relaxed, and your hands get warm and dry. Biofeedback is simply just measuring that part of your physiology. We could measure heart rate. We could measure respiratory rate. We could measure muscle tension. We could measure how warm or cold your hands are and how sweaty or dry your hands are. Being able to measure all these things is really what we see. And using biofeedback, we could really get a peek into these systems and see where you are and see how your nervous system is responding. That being said, what could we measure using biofeedback? We could measure, we already talked about, we could measure your heart rate. We could measure your respiratory rate. We could measure heart rate variability. We could measure skin temperature. We could measure skin conductance, which is the sweat on your skin. We could measure EMG biofeedback and see how tense the muscles are. We could also measure brainwave. Neurofeedback is a type of biofeedback. We could measure the different types of brain waves that your body's producing in different areas of the brain as well. All of these are types of biofeedback, and I'm going to get into each one of those and what they're actually measuring now. Heart rate variability biofeedback. Heart rate variability biofeedback measures the difference between the speeding up and slowing down of your heart rate. Oh, there's something that's called normal sinus arrhythmia. Normal sinus arrhythmia is when you breathe in, your heart rate is supposed to speed up a little bit. And then when you exhale, your heart rate is supposed to slow down a little bit. And that's normal. There's normal fluctuations. If you take your pulse and your pulse is 70 beats per minute, that's not a uniform 70 beats per minute. That when you breathe in, on every inhale, those beats are a little bit faster. And on the exhales, those beats are a little bit slower. The difference between the speeding up of the beat and the slowing down of the beat is called heart rate variability. What measures the difference between the speeding up and slowing down of your heart rate, and what it really does, it's a measure of the adaptability of the nervous system. Someone with a high heart rate variability has a very adaptable nervous system. This is your professional athlete, your CEO. A CEO is a great example. CEO could go in and get some bad news. Hey, your company just lost millions of dollars. And then they have to go out and they have to do a presentation and motivate their whole staff. You get all this stressful news and you could recover from that and you could go and you could compose yourself. Someone with a high heart rate variability is going to be able to shift from the sympathetic state to the parasympathetic state effortlessly. Or I always think about basketball players running around the court. They're running around the court, heart rate is racing, they're in their sympathetic system, they're fighting for balls. And then you get fouled and you have to go to the foul line. You have to calm everything down and you have to be smooth. That's why you see a lot of these professional basketball players, they get to the foul line and they do some slow breathing. They're trying to shift into that parasympathetic state. You have to be able to go from the sympathetic state to the parasympathetic state effortlessly. And that's what someone with high heart rate variability can do. So now if you have low heart rate variability, you're not very adaptable. And if you get some bad news, let's say you're told that you just lost a lot of money or you heard some bad news, you're done for the day and you can't recover. You can't shift back to that parasympathetic nervous system. So that's someone who has a less adaptable nervous system. We need to be able to shift. Someone with high heart rate variability needs to be able to shift from the sympathetic to the parasympathetic branches of their nervous system effortlessly. And we could measure that. We could measure that using these devices. All these devices use heart rate variability. When people talk about the Whoop or the Oura Ring or Apple Health, and the Apple Watch could tell you how well you're sleeping and how stressed you are or relaxed, they're all using heart rate variability as a metric for that. So it's a really important metric. And we measure this all the time in the clinic while we're doing exercises with clients. The next type of biofeedback is thermal biofeedback. Thermal biofeedback measures skin temperature, especially in the hands. So, when you're really stressed out or someone who's very anxious or stressed all the time, their hands tend to be cold. And when you're more relaxed, your hands tend to be warm. Oh, we talked about that before. When you're in this sympathetic branch of your autonomic nervous system and you're in fight or flight, the blood rushes out of your hands and out of all of your internal organs into your large muscle groups. The hands get cold and the hands get sweaty. Thermal biofeedback measures blood flow to the skin of the hands and fingers. And a decreased temperature, colder hands reflects a sympathetic activation or a fight or flight, and warmer temperatures, increased temperatures, reflects parasympathetic engagement and safety. When we're doing exercises, we want the hands to be warm, and it's very simple. If I had a device to measure the temperature of your fingers, the temperature of your hands, while you're doing relaxation exercises like breathing, meditation, visualization, and you're doing those and you're thinking positive thoughts, your hands should get warmer if you're having the appropriate response. So we use this all the time, this type of biofeedback, and it's very simple and you don't need much tools at all or technology at all. You just need something to measure the temperature of your fingers. And we'll talk about different types of biofeedback that measure this. The next metric is skin conductance. And now skin conductance is measuring the sweat gland activity, which is driven by the sympathetic nervous system. So it's measuring the sweat gland activity in the hands. When you have a sympathetic nervous system or fight or flight arousal, your hands are going to get sweaty and you're going to have increased sweat response of the hands. Now, this is very sensitive. It happens, it's the metric that reacts quickest. Once you're stressed, the hands will get sweaty right away even before temperature changes, or maybe even before muscle tension changes, definitely before heart rate variability changes. This happens really quick and we could measure this. With some of these biofeedback devices, we're measuring a few different things. We want to see what is affecting your physiology. Now, the skin conductance or measuring the sweat on the hands is very sensitive to stress and arousal. And it often changes before you even consciously realize that you are stressed. Well, we could use this for awareness of your autonomic nervous system, to be aware if you are in a sympathetic state or in a parasympathetic state, and to help you control it with different type of self-regulation exercises. The next metric that we use for biofeedback is EMG biofeedback, which measures muscle tension. Well, EMG measures the electrical activity in the muscles, and it could tell whether your muscles are tense or relaxed. Well, what I'll often do in the clinic is put some electrodes, EMG surface electrodes, on someone's upper trapezius or their neck muscles. And we could see if they're tense and if they're doing exercises appropriately that are getting them into their parasympathetic state, we're going to see less activity in those muscles, and those muscles are going to be more relaxed. And we do things like progressive muscle relaxation or different techniques to decrease the tension in some of these muscles, especially with people who have headaches or migraine. They have a lot of tension in their facial muscles or in their scalp or in their neck muscles or in their jaw. And we could use surface EMG electrodes to see the activity in these muscles and see how they could tense and relax these muscles. They really, sometimes you may even have increased tension in these muscles and not even realize it. But we could measure the tensing and relaxing of different muscle groups. And the last metric that I want to talk about just briefly, because I think we're going to do a whole episode on this, is neurofeedback. Neurofeedback measures brainwave activities. So with neurofeedback, you put some kind of sensors on your head, and it could be simple sensors, like they have these devices like the Muse or some other things that you could put a sensor on your scalp, and it measures brainwave activities. And it's another way to see if you're in a stressed or sympathetic state or a more relaxed state. Someone who isn't in a relaxed state may produce more alpha brainwaves, and someone who's in a sympathetic dominated state or a fight or flight state, they would produce more high beta wave. We could tell by the different brain waves which state they're in. Simply said, that biofeedback is really just a tool, and it's using technology to measure heart rate, respiratory rate, heart rate variability, finger temperature, sweat on the hands, muscle tension, brainwave activity. We are using technology to measure all of these things to see if you're in more of a sympathetic state or in a parasympathetic state. And it really gives you a good look. Knowing all these things, it gives you a good look into your nervous system and to see how you can control your nervous system and how you can help. And if someone who has a controlled nervous system, or they could get out of fight or flight and get into their parasympathetic system, their pain will hurt less and the dizziness won't seem as bad. You could help control your pain and dizzy symptoms by using technology to measure if you could be in or out of these different states. I wanted to touch on the difference between the wearable devices that you wear 24 hours a day and you wear to sleep, and some real time biofeedback that someone would use, or you would go to a physical therapy clinic or a psychologist that would use in their office. Wearables track your physiology and they track trends over time. You wear it all day, you wear it to sleep, and it's you could tell just wearing it all day to day, week to week, month to month, year to year. You're looking at trends. Is my heart rate variability responding well? Is it improving with my exercise program? Is my sleep improving? People use it to track. If I have one drink, what does that do to my heart rate variability? One drink of alcohol versus if I've had a few drinks of alcohol, what that does to my heart rate variability. You could use these wearable devices like the Whoop and the Oura Ring. Garmin has a watch that you wear all day, and Apple has the Apple Watch that you could track all the trends on also. I think they use Apple Health. Basically, it measures constantly all day, and you're really looking at trends. They're not that good at real-time data while you're doing an activity, if that's really having the desired effect. Whereas using biofeedback machines, like there's simple machines like HeartMath that I'll get into a little bit, or I use this thought technology, Procom 5, or some other biofeedback devices that they could tell in real time from minute to minute, second to second, if you're having a heightened sympathetic response or a parasympathetic response. And basically you could see what exercise works best for you, what breathing exercise gets you into your parasympathetic zone quicker, which self-regulation exercise gets you to relax quicker, what makes you stressed. We could kind of measure different things in real time. Biofeedback, I would say, measures things in real time, and we could see moment to moment how your nervous system is changing, where these wearables, which are great, they also great to track trends over time. And tracking trends over time is great because that's how you develop healthy habits. Wearables track patterns to encourage healthy habits, and biofeedback allows you to train your autonomic nervous system. These are two different ways to use technology to improve symptoms with pain and dizziness. The reason I like biofeedback is it really validates your exercise. A lot of people were told, they're like, hey, you have all this pain and it appears that you're going through a stressful time in your life. So go do some breathing exercises or do meditation or do some cognitive behavioral therapy or other type of therapy. And that alone, people usually start programs, but it's not very motivating and it's a little bit invalidating. So basically, if you are recommending for a client who is going through a stressful time or could benefit from self-regulation exercise, it's powerful to be able to see on the computer screen that you're doing this exercise and you're actually making changes in your heart rate. The heart rhythm, the sinus arrhythmia goes through this nice pattern. When you're breathing in, you really see the heart rate increase. And when you exhale, you really see the heart rate decrease. And when you're doing nice, slow, extended exhale breathing, you could see a nice parasympathetic pattern. And you could see on the screen that your hands are getting warmer and your hands are getting drier and your muscles are getting more relaxed. It's nice to be able to see, and it's very validating to see on the screen that you're actually making changes in your physiology, and you're not just doing these breathing exercises or doing headspace just to do something to decrease stress. And the most important thing about this is these self-regulation exercises are cumulative. They don't necessarily work the best in real time to when you're stressed or when you have a huge pain flare or pain episode to decrease the stress or decrease the pain. It's better used over time. Doing self-regulation and breathing exercises every day makes it less likely that you have a pain flare and makes it less likely that you experience dizziness and makes it less likely that people get on your nerves and you're able to deal with stress a little bit better. Oh, it's really cumulative. I found that these exercises are cumulative and they just help the nervous system overall. So I want to talk about some of the devices that I have used over the years. Basically, I've been using biofeedback for at least 10 years, probably closer to 15 years. And as simple as you could use a heart rate monitor, right? Simple as a heart rate monitor, like a Polar chest strap heart rate monitor that just measures your heart rate. And you could have devices that measure heart rate variability, finger temperature, skin conductance, EMG, muscle tension, all at once. So you could go really simple and just measure the heart rate, or you could measure all these things at the same time. I've worn a Whoop before. A Whoop is a wristband device. It's wearable technology. You're supposed to wear 24 hours a day. And I find that it's a really good device to track trends over time. People wear this Whoop device. It's probably best used for endurance athletes, people who are training for marathons or triathlons or something like that, because there's a huge cardiovascular component to it, and their HRV algorithm tends to favor the endurance athlete. But the Whoop is a really good device. They have some really good on-screen data. You could track your HRV. It gives you daily trends, and it's a good way to track your daily trends and activities and metrics. I feel like it measures mostly heart rate variability, and the newer models measure wrist temperature, and I think they might measure some skin conductance also. Now, the Apple Watch also, I wore an Apple Watch a little while. That was good. And I tracked my heart rate variability on that. And I noticed that using an Apple Watch, you have to wear it all the time, though. You wear it all the time. You wear it to sleep. It does a heart rate variability calculation at night while you're sleeping, and you could measure trends over time if your heart rate variability or your nervous system is in a better state. That heart rate variability is going to be high. And then if you're in a stressed out state or a more sympathetic state, your heart rate variability will be low. And then the other device that's similar to this is the Aura Ring. So an Aura Ring is very much like the Whoop. You wear it on your finger. It measures finger temperature, measures heart rate variability. You could track trends in your sleep and HRV and activity levels throughout the day. These are good devices, again, for tracking trends, and they are all considered biofeedback because they're using technology to measure your nervous system. Now, in the clinic, as a physical therapist working with people with pain and dizziness, the first thing I usually use if I'm introducing biofeedback to a client is HeartMath. HeartMath is a simple, real-time HRV biofeedback that it's a simple device. You clip it on your ear. There's some good software. You could try some different breathing patterns. You could have someone do box breathing or extended exhale breathing or do some meditations that they're used to or a body scan, and you could track their heart rate variability while they're doing it. They use a score called a coherence score, and a coherence score is basically when you're breathing, your respiratory rate and heart rate, the fluctuations of your respiratory rate and heart rate are in sync. It's trying to measure if as you breathe in, does the heart rate speed up? And as you breathe out, does the heart rate slow down? And could we get into that nice smooth pattern? And then HeartMath, it's very cool to see because as your HRV or coherence is increasing, the line goes up and you go into this green zone. And if it's decreasing and you're going more into a sympathetic state, into a fight or flight state, then it'll go into a red zone. So you could see, and they have some games for kids where if your HRV and coherence are increasing and you're getting into that more parasympathetic state, there might be a balloon, like a balloon ride, and the balloon goes up. And when you're in the sympathetic state or you're feeling a little more stressed or you're not following the pattern as well, then the balloon goes down. So it's a good activity. There's different things and rewards to keep you engaged. The other biofeedback that I use pretty regularly is a device from Thought Technology called the Procom 5. Now, that one measures finger temperature, skin conductance, heart rate variability, respiratory rate, and EMG muscle tension. You have these 5 metrics that are measured, and you could see everything. And what I usually do with that is the first thing I would do is bring someone through a quick assessment where I have them try to sit and relax and form a baseline. And then I have them do a bunch of math problems for 2 minutes. So I stress them out with math problems because math stresses everyone out. I'll have them do that and then see what happens from doing 2 minutes of a timed math problem. You could see someone's heart rate goes up. Their muscles get a little more tense. Their hands might get sweaty and their hands might get cold. And then I'll take the next 2 minutes and I'll teach them a breathing exercise and see if they could lower their heart rate and get their heart rate variability to increase and get their hands a little warmer and hands a little drier. You're doing something to stress people out and then you're doing something to relax. We could see if we could control the nervous system, because remember, having a good adaptable nervous system doesn't only mean that you could get into the parasympathetic relaxed state, but you could shift back and forth between the states effortlessly. I use the Thought Technology Procom 5 a lot. I also have this other device that's the EVU TPS from Thought Technology. That's a simpler device that measures heart rate variability, finger temperature, and skin conductance. And then some of the other devices I've used over the years, I've used just a finger thermometer. Oh, I bought a finger thermometer on Amazon. You could buy a finger thermometer for $10 on Amazon. You hold the wire in your fingers. It tells how warm your hands are. And when you're doing your self-regulation exercises, if you're getting more relaxed, your hand's going to get warmer. So it's a very simple, low budget, friendly way to do biofeedback just using a finger thermometer. Or you could even use one of those, what do they call those temperature things that you put in your hamburger or your steak to see when it's done? You could use a temperature probe and just hold it on your fingers and see if your hands get warmer. They also sell these temperature dots for kids where, sometimes you put it on the kid's forehead to see if they have a fever. So they have these stickers that you could put on your hands and they change colors when you get warmer. So that's another simple way to measure finger temperature as you're doing the relaxation exercises. Another thing I've used before is a pulse oximeter. That's the one when you go to the hospital and they put your finger in this thing and they tell you your oxygen saturation and your heart rate. You could just use your heart rate and see if you're doing a relaxation exercise. If your heart rate gets lower, then you're on the right track. I've also used some neurofeedback devices. So some of the neurofeedback devices that I've used, I've tried the Muse for a while. Muse is a very popular device, little headband. I found it a little bit flimsy. You put this headband on your head and it's pretty cool. When you get into the alpha state and you're more in a parasympathetic state, you hear birds chirping. And the more birds chirp, the more parasympathetic you are. And then if the birds stop chirping, then you're in the sympathetic state. Or you get that audio feedback, whether you're relaxed or stressed, based on a brainwave stimulation and how much alpha wave you're producing. I've also used this device called the NeuroVital, which I think is a pretty cool device. It's a little, I feel like it's a little more sturdy than the Muse, and I like the iPad technology that it comes with. And same thing, it could measure alpha waves, beta waves, delta waves, or it could measure, there's different activities that you could do if you want to work on focus. You wear this headband and then you watch a marble go through a maze. And when you're focused on it, the marble moves. And then when you lose focus, the marble stops. So you get this visual feedback, whether you're in the right state you want. And there's relaxation ones. And when you're in a relaxed state, the music gets louder and the pictures get more vivid. And when you're in a stress state, the music stops. This is all real-time biofeedback. Using biofeedback, the purpose of it is really to get a look into the autonomic nervous system and see that you have some control over it. Next, I just wanted to go over how I would use this in the clinic. I use it for all my headache patients. Anyone who comes in with headache or suffering from migraine, doesn't want to take medication, or they're even struggling with trying to find the right medication, we start with biofeedback. Someone with migraine, I usually use the 5-channel biofeedback, and I'll do a quick assessment and I'll show them that they have control over your nervous system. You could make these metrics go down. You could make your hands warmer. You could make your muscles more relaxed. You could make your heart rate variability go higher when you're in a relaxed state. And then we also see how, if you are stressed, how it changes and fluctuates. Well, what I'll usually start with the 5-channel biofeedback, and I'll teach people with migraine how to do a progressive muscle relaxation, where it's like tensing and relaxing different muscles of their face and neck and body, to try to show them that they could relax those muscles while measuring tension in those muscles. Then we'll do some pace breathing, and we'll do some different breathing techniques and try to find the best resonant frequency or the best speed at which you breathe. It might be 4 seconds inhale, 6 seconds exhale, or it might be 4-second inhale, 8-second exhale. Some people might do better with a pause in between breaths. Some people might do better with a box type breathing. We try all these different breathing patterns, measuring their heart rate variability and seeing which one responds the best. And then with migraine patients, I'll also do hand warming visualizations. We'll do visualization or meditation, guided meditations and visualizations, while measuring their finger temperature and see if we could get their hands warmer. And you should see, like, as you're in this relaxed state, people's hands could go 5 degrees warmer. You come in with cold hands, and when you're in that relaxed state, your hands could get 5 degrees warmer or 8 degrees warmer. We're looking at the changes in that metric. Now, I also use biofeedback regularly with people who are dizzy, and people who have back pain, and people who have symptoms post-concussion. And I use slightly different protocols for each of those clients, and everyone's really different. But I always measure heart rate variability. Sometimes I'll measure muscle tension. Sometimes I'll do thermal biofeedback. Sometimes I'll do neurofeedback where I'm using brainwaves. Biofeedback could be a great tool for taking a look into your autonomic nervous system, and it gives you objective, real data. You can see if these exercises like breathing, meditation, progressive muscle relaxation are having that desired effect. It's been very effective in my practice as a physical therapist, working with people with persistent pain, migraine, post-concussive symptoms, long COVID, chronic autoimmune symptom. A lot of these chronic type cases, they respond really well to biofeedback and self-regulation exercises. Now I'm going to take everyone through a quick example or a pretty powerful tool called box breathing. Box breathing is one of the go-to self-regulation exercises that we use in our practice, and they use it. It's definitely well understood, well studied, very simple to do, very simple self-regulation technique to use on your own. Box breathing works because it creates predictability in the nervous system, and predictability equals safety. So you're going to breathe in 4 equal phases. You're going to inhale, hold, exhale, and then hold at the end. And you're going to do that all for the same amount of time. And think about it like breathing through 4 sides of a box. What's equal breathing throughout 4 sides of a box? Now, you don't need to breathe deeply, and you definitely don't need to force anything. And I'll always say you can't relax with intensity. You can't do these relaxation exercises super intensely. But we're just going to slow things down, and we're going to let the nervous system get into that relaxed state. Remember, obviously, if you're listening to this while you're going for a run or you're driving a car, it's going to be hard to do. If you're somewhere where you could be safe, let's get started. And you could sit upright in a chair, or even lying down would be great also, either sitting or lying. And if at any point this doesn't feel right, just return to your normal breathing. Sometimes doing these exercises, you might get a little bit lightheaded. Then you would just return to your normal breathing. Okay. So let's everyone sit or lie down, right? If you're sitting, you want to sit upright in a chair, feet flat on the floor, and just start to take a few nice, relaxing breaths. Start to slow down your breath a little bit. And we're going to go through about a 3-minute box breathing session. For our pacer, I'm going to use an iPhone app called iBreathe. It's going to be a box breathing pacer. It's going to say inhale, hold, exhale, hold. And this way I could talk you through some of the activity. So you're going to hear this woman's voice. That's a pacer, and we're going to follow along for 3 minutes. Let's begin.
Inhale.
So you're going to inhale through your nose gently.
Hold.
You could exhale through your nose or mouth. Try to release tension.
Hold. Exhale. Hold. Inhale.
Now, on the next exhale, I want everyone to really think about letting your shoulders and all the muscles of your face relax.
Hold. Inhale. Hold.
And on that exhale, you're going to let release all the tension in your jaw and in your facial muscles.
Inhale. Hold. Exhale. Hold. Inhale. Hold.
Sometimes that last hold after the exhale gets uncomfortable. So you could just keep exhaling during that last hold.
Hold. Exhale.
And exhale, relax all of your muscles.
Hold. Inhale. Hold. Exhale.
And you could see if you were wearing a HRV wearable device or a biofeedback device right now, you would be able to monitor your finger temperature and your HRVs
Exhale.
and your muscle tension.
Hold.
Let's do 2 more breaths.
Inhale. Hold. Exhale. Hold.
And one last round.
Inhale. Hold. Exhale. Hold.
And now let's just let your breathing return to a nice, slow, normal pace. Great. To wrap this up, biofeedback is a way to look inside your autonomic nervous system. It gives you objective data to see whether tools like breathing, muscle relaxation, and visualization are actually doing what we want them to do. In my practice, I found this incredibly helpful for people with persistent pain, migraines, post-concussion symptoms, dizziness, long COVID, or chronic autoimmune conditions, especially when symptoms feel unpredictable or scary. Biofeedback helps remove the guesswork. It shows you that your nervous system can change and that you're the one driving it. A quick reminder, this podcast is for educational purposes only, and it's not medical advice. And individualized care should be coming from a qualified healthcare provider, which is very important. Oh, if you're looking for physical therapy evaluation or some biofeedback assessment or a biofeedback training, you could find us at dynamicssportspt.com. And if you would like some more education and some tools around pain and dizziness, you could head to painanddizzy.com. Thanks for listening, and I'll see you next time.